Some people are walking in our hospitals right now wearing scrubs. They're licensed, but they don't have the knowledge to save a life. And the scariest part about it is that you don't know who is who. You don't know the difference between the fake nurse and the real nurse. And so we're going to talk a little bit about it today, because that is something that is like going on in social media right now, where there's so many persons that are fake in terms of nursing. I know it's a little bit uncomfortable in terms of the discussion, but it's something that needs to be talked about, because I don't know what's happening in healthcare, but a lot of persons are not talking about it openly. And so we're just going to talk about the ones that are cheating their way into nursing. And before anyone gets, a little bit defensive about it, let me just say that this is not a video for the ones that are struggling, the students that are struggling, or the students that are needing help or any form of tutoring. This is about fraud, intentional shortcuts in a profession where mistakes can cost a life. This is the one video for those individuals. So what's actually happening? So let's just talk about it for a few minutes, because there have been real cases where nurses, real ones, real individuals, persons are paying their way through nursing. They pay someone to take their exams, fake their clinical hours, they've bought transcripts or their credentials, or they went through programs that cut corners just to push through the program, so they can actually get a bachelor's, or associate, or so they are a registered nurse. So on paper, they look like nurses, they pass the background check, they get hired into a job, and then when it's actually time for them to take care of patient, that's when the cracks start showing. They don't know what to do. But we have to remember that in nursing is not just about memorization, or it's not about memorization. It's about critical thinking. It's about you understanding pattern recognition. It's you knowing when something is not right before it becomes an emergency. And you cannot fake that. So all of those persons out there, I'm sorry for you. I am so sorry for you guys. But this is so dangerous. The ones that fake their, way through nursing, it is so dangerous in the real world, because imagine a patient crashing, the blood pressure out there dropping, and any subtle changes in that patient's condition, they won't be able to pick it up. While you have a trained nurse who is able to pick up any changes in that patient's condition from early, they're going to be able to call out and intervene from early. But when you have someone who cheated their way through nursing school, they're not going to be able to recognize any of the signs. That is going to delay care. They might end up freezing, looking all over the place. And what happens in nursing when you have a delay in care? It costs a patient a life. It can cost a patient a limb. And this is not like any other profession where you can just learn slowly on the job. In nursing, you're expected to show up with at least the baseline level of competence, because people are depending on you immediately as soon as they step into the field. As soon as you walk into those hospitals, they're expecting you to know something to save a life. And it doesn't affect just the patient, it affects the entire team that is there. So if you don't know it, what is going to happen? Other nurses are going to have to pick up your slack. The errors start increasing, and then that is when trust is broken between the individuals that are working. But when you have fake nurses out there, what is going to be happening to the real nurses? It affects them. Because the ones who actually did it right, they are the ones that, so we're talking about the ones that stayed up all night and study, the ones who failed the exam and had to try again and try again, the ones who cried after the clinicals, they questioned themselves over and over if they made the right decision, all of those things. Those are the ones I'm talking. We know that nursing school is not easy, and it's not supposed to be. Because all of those individuals that struggle through nursing school, that process is what is building them. It is building their judgment. So when somebody bypass all of that, it is not just being unfair to those individuals, but it undermines the entire profession. Because now you have patients who are out there, they're starting to question, can I trust my nurse? And just imagine you have a nurse who went through all of that struggle. And now you have somebody questioning whether or not that nurse is a real nurse. That should never be a question that they should be, be thinking about. So let me just say something here, because in healthcare, when In healthcare, you can tell when somebody knows something, from when they're guessing, because it shows up in how the person go about with assessing a patient, how the person speak, how they respond under pressure. And one thing about confidence is that you can't fake it. So you can fake all your nursing license and everything, but you can't fake confidence, especially when you have a patient that is deteriorating. You can't Google your way out of a code or a trauma. And that's a reality that a lot of persons don't talk about. So you see nursing and nursing online, social media looks beautiful. No, you can't fake your way through certain things. And not until you're at the bedside, that is when the truth actually shows up. So if you're thinking about cutting shortcuts, if you're thinking about, faking your way, cheating your way through nursing school, let's just be clear here. This is the wrong profession. This is not the profession for it. Because one day it is gonna, it'll catch up on you. You will be the only person standing between the patient and that one bad outcome. There is not gonna be a cheat sheet. There is not gonna be any second chances in that moment. It's just gonna be you and what you truly know. And if you just don't know it, a straight up prison you go. Right up prison you go. The patient might die because of your incompetence. So make the right decision from now. So if you're on that journey, I want us to do it right. If you need to struggle from early. Start struggle now if you need to. It might take you a little bit longer, but go ahead and start struggling. Ask for help, learn, grow, but in the end, you earned it. Because at the end of the day, remember, nursing is not all about passing a class. It's not all about passing a course. It's about you being safe. It's about you being competent. It's about you being the nurse your patient deserves. Everybody needs somebody that is competent and safe, that is taking care of them. That is all they need. So if you go ahead and cheat your way through nursing school and get fake license and fake degrees, it's not going to be worth it. All right? Remember that. Your struggle will make you stronger in the end. And we need strong, safe, and competent nurses. I do hope you will have a wonderful day. Go ahead and leave your comment down below. What are your thoughts on the fake nurses that are out there? And let me know if you're going to be questioning the next nurse that is coming in front of you. Are you going to be having doubts about whether or not that nurse is a safe nurse? Meaning, is that a real nurse or a fake nurse? Go ahead and leave your comment down in the box below, and I will see you in the next video. Remember to go ahead and subscribe to my YouTube page here, I Think Nursing. Follow me on the other social media platform, I Think Nursing, where I do share content, and I will see you in the next video.